What type of test does an upper cervical chiropractor use to determine whether you have an upper neck misalignment or not, and whether you're a candidate for care? If you come into any upper cervical office, including ours here in Sarasota, Florida, we'll first take a history to find out what you're dealing with. And then we'll run you through a battery of tests to determine whether you have an upper neck misalignment or not. So there's three main tests we run. The first one's called infrared thermography, which is basically a machine that we run up the back of the neck, and it has two probes. And basically what it does is it sends an infrared beam to the surface of the skin on both sides of the neck and measures the heat balance. Now, surface skin temperature is a window into what we call the autonomic nervous system. And the autonomic nervous system is controlled right there in what we call the brain stem. That's the seat of control for all the function in the body that functions automatically without your conscious control. Now, the capillary beds, which are the really small blood vessels in the surface of the skin, that infrared thermography device measures the first 5 millimeters of capillary beds. If your nervous system's functioning properly and is controlling both sides equally. In other words, you go outside and it's hot, your blood vessels on the surface of the skin are going to dilate to let heat out because your body is always trying to maintain 98.6. And if it's functioning properly, both sides will either dilate or constrict within a sort of normative value, which causes surface skin temperature to be balanced. Now, if the upper neck is locked and is irritating the brainstem and is affecting the dilation or constriction, which is controlled by smooth muscle, which again is controlled in the cord, one side may adapt or dilate a little differently than the other side, and that creates a heat imbalance. So thermal heat imbalance or balance is a window into how well nervous system's functioning or how poorly it's functioning. We call it a pattern. So if we run a scan up someone's neck and we were to run a scan on them once a week for a year and they never had their upper neck corrected, they're going to show the same general heat pattern that doesn't change if they have an upper neck misalignment. So the goal, once that vertebra is corrected and the pressure's off the cord, central nervous system is going to control the cardiovascular system, including that dilation and constriction of the capillary beds on the surface of the skin. And when it's corrected, their follow-up visits, you're going to see the heat pattern on the surface of the skin change. If it doesn't, if someone's under upper cervical care for 2 months and the scan shows the same exact pattern over and over, it's a clear sign that a correction is being made, but it's not the right correction. It's not clearing all the way. It's not staying in position. It's not staying clear of the nervous system to allow the body naturally to come back into more balance. So first test is thermography. The second test is leg length balance or inequality check. Because this brainstem controls postural muscle tone, if the upper neck segments are in motion and where they should be and not irritating the cord, the balance of the musculature on both sides of the spine is going to be fairly balanced. The head's going to be on straight, the shoulders should be balanced, the hips will be balanced, and the legs will be even. If you've had an injury and that segment's locked out of position and is irritating the cord, the muscles will contract on one side of the neck and the other, causing the head to be off center. One shoulder generally will be higher than the other and rolled forward. And you can't see my pelvis, but one side of the hip will raise compared to the other, and one of the legs will be short. Now, that short leg is what we call functional. It isn't due to the structure or the bones being shorter on one side and the other. It's due to the imbalance in the muscle tone through the spine, which is caused by irritation in the cord. And the third thing that we do, which is the least important, we do muscle tone palpation in the upper neck. When a joint in the neck locks out of position, there's usually a tight, beady knot around it. And after we make a correction to get the joint back clear, back in motion, that muscle knot will tend to relax. So those three tests are used initially to determine, do you have a problem and where? And then we take imaging, 3D imaging that looks at, let's say, the atlas, the top vertebra is the only one that's off. This joint here and this joint here fits to the bottom of the head. And where those two joints fit, they fit like perfect mirror images. So if that vertebra is locked, it's going to happen at the joint level. And if we can look at the outside joint of C1 and how it fits to the skull, we can see, is this outer margin even? Is it off like this? Or is it slipped under like this? And by looking at both joint margins, we can tell how you're off. Once we have that information, a precise correction is made to correct the vertebra, and the long-term objective of upper cervical care is to get that vertebra to stay in its normal position as long as possible. So the follow-up care after someone has their initial correction, when you go see an upper cervical chiropractor, is to check to see, is the segment in its normal position or is it locked out of place again? The longer it stays in position, the faster the soft tissue heals up around the joint, the faster the structural will return to normal, and the faster the internal physiology will come back into balance and you'll recover your lost health. So hope this helps many of you understand what we do in the office, kind of the objective and some of the testing that an upper cervical chiropractor uses.